Oh, hello everyone. My name is Gail Nicholson and I'm a Health Promotion and Improvement Officer in IHA Dublin North City and West, and I'm here today to provide some information on the harms of alcohol, both to physical and mental health, in particular with regards to men's health, as well as ways to reduce those risks and information on supports and services available in the area. So the learning objectives of today's webinar are to outline the specific risks men face from alcohol use, influence of cultural and social norms on men's drinking behaviours, evidence-based strategies to reduce alcohol-related harms, and training and resources to support healthier coping mechanisms and lifestyle choices. So I always begin with what alcohol actually is. So alcohol is a toxic, psychoactive and dependence-producing substance and a group 1 carcinogen. This means that it's causally linked to 7 types of cancer, including esophageal, liver, colorectal and breast cancers. It's associated with 740,000 new cancer cases each year globally. I just wanted to show this graph then in relation to a study that was done where it looked at the harms of all drugs, and these were in relation to the harms to the person as well as to the community. So they looked at heroin, cocaine, cannabis as well as alcohol, and we can see that the bar on the left are the harms related to alcohol, and these were so much higher than all of the other drugs. So I don't think that people realise just how harmful alcohol is because it's so normalised in society, and drinking alcohol is accepted as part of every celebration, important occasions, as well as socialising. So in terms of the levels of heavy drinking of alcohol, Ireland ranks 6th in Europe for alcohol consumption, and we are one of the highest in Europe for drinking more than 6 standard drinks on a single occasion. The lower risk guidelines for weekly alcohol consumption for men is no more than 17 standard drinks per week spread out over the course of the week, with at least 2 to 3 alcohol-free days. And for women then it's 11 standard drinks per week. These low risk guidelines are being reviewed at the moment because, as we know, alcohol is a carcinogen. The World Health Organization's position on alcohol consumption is that there's no safe amount that doesn't affect health. So stating that low risk may not be correct in terms of public health messaging. So in terms of men's alcohol use in Ireland, Irish men have very high levels of alcohol consumption and also a consistent pattern of binge drinking, which is defined as drinking at least 6 standard drinks on one drinking occasion, which is especially dangerous to health and well-being. Alcohol is the world's leading risk factor for death among males aged between 15 and 59, according to the World Health Organization. 1 in 4 deaths of males between 15 and 39 in Ireland are due to alcohol. So in essence, alcohol is hugely harmful to our men. The Health Research Board's Alcohol Overview series from 2024 states that 51% of all drinkers are classified as being hazardous drinkers. This was more common among males at 65.7% and particularly younger males. Males are more likely to binge drink on a typical drinking occasion, with 37% drinking alcohol in this way, and this difference is reflected across all age groups. Alcohol use disorder is more common among male drinkers at 24.8%, and 37% of younger males aged between 15 to 34 are classified as having an alcohol use disorder. So one key thing I suppose I'd like to highlight is that when it comes to alcohol and the problem of alcohol, it's not necessarily on us as individuals. Since the day that we were born, we are being given cues that alcohol is a normal part of life. Advertising is everywhere that alcohol is a key part of fun times, weddings, socialising and celebrations, and even in hard times like funerals. We know that the alcohol industry are very good at their job in selling their product. So we're thinking of ways to shift the spotlight away from alcohol and to thinking that an alternative is possible, and away from alcohol, we'll be better able to focus on the real stars of our lives, our families, friends, work and our passions. A key point as well is the way that alcohol is tied up in masculinity in Ireland. So becoming a man can be centred around that first pint, or indeed how many drinks a man can drink on one occasion is seen as strong or masculine or impressive, whereas the opposite can also be true. Just a bit more, I suppose, on the context and societal piece again. To note that the new labelling legislation has been signed into law since May 2023 and it was to be operational in May 2026. But now, due to huge lobbying activities by the alcohol industry, this has been pushed further back now to 2029. Just to provide a picture of the work that's gone into bringing this about, is that this was the most contested piece of legislation in the history of our state. So that's in more than 100 years, which shows that although they're quite modest and they state the harms caused as any product should, they really must be significant due to the level of hysteria and pushback from the alcohol industry to bringing these into legislation. We've also recently had attempts to push through the sale of alcohol bill with no consultation from the Department of Health on the impacts of increasing availability and opening hours, for example. We know that the World Health Organization best buys for reducing alcohol harms is reducing availability. So that's the context that we're living in. We know that hazardous drinking can increase the risk of alcohol-related harms, specifically the likelihood of poisoning and accidents or falls, as well as alcohol-related conditions such as cancer, heart disease and liver disease. These are some of the known cancers that are caused by alcohol. So it's basically where alcohol comes in contact with the upper digestive tract. And then, of course, we have liver and bowel cancers. So 6.7% of male cancer deaths in Ireland have been attributable to alcohol. So that's 2,823 men. Among Irish men, the majority, so more than 63% of alcohol-related cancer deaths were in the upper aerodigestive tract, for example, mouth and throat cancers. And in Ireland, the proportion of alcohol-related deaths from cancer for men is higher than the European average. So it's 20.7% for Irish men versus 17% in Europe. There are other wide ranges of health and well-being effects from alcohol. Alcohol can damage the heart or interfere with the way that it works, and this can cause different problems, including high blood pressure. This can significantly increase your risk of stroke, heart disease like cardiomyopathy and arrhythmias, and also chronic kidney disease. Alcohol can cause vascular dementia caused by not enough blood being able to get to the brain. Liver disease, as this can happen at levels really that are lower than we may think. It's not necessarily people with addiction issues. It can be people who may be drinking 2 bottles of wine per week, for example. And we know that the liver cannot heal, so this is a growing concern as there are more and more people ending up with liver disease and failure than ever before. And finally, then we can have alcohol-related brain injuries. This can happen from repeated drinking sessions where more than 6 standard drinks at one time are consumed. Another key point is that when we drink alcohol and smoke, the harms are greatly increased. Combining smoking and drinking significantly increases the risk for developing cancers in the aerodigestive tract, so the lips, mouth, larynx, pharynx, throat, esophagus, and colon. For many people, smoking and drinking go together, so it's important that people are aware of how harmful this is. Smoking and drinking together can also cause high levels of fat in the blood and high blood pressure, in turn causing cardiovascular disease like stroke and heart disease. And this applies to vaping as well, so there are significant harmful chemicals that can interact and increase the harms. So just reminding that we have a free stop smoking service where you can get weekly support from an advisor, as well as 3 months free nicotine replacement therapy, which is fantastic and really does work for those who want to quit. And these are the contact details both for nationally and then for the Dublin North area. So in terms of alcohol and mental health and well-being, alcohol can cause depression or make it worse. So if we're looking at this graph, we start at the top left with depressive symptoms, and moving across then to the right, naturally we're looking for ways to cope with these difficult feelings. Moving down then to the bottom right hand, people may use or self-medicate with alcohol. And while alcohol may make you feel less anxious and improve your mood while you're drinking, the effects wear off and you can feel worse than you did before. And then moving across then, because alcohol changes your brain chemistry, we feel more down or anxious the next day after drinking. Moving up then to the first part of the circle, which adds to depression and anxiety and further makes the person want to self-medicate and continues this alcohol depression cycle. The link between alcohol and suicide has been well established. Alcohol is a factor in more than half of the suicides in Ireland, and 4 times more men than women die by suicide. The All Ireland Young Men and Suicide Project report found that alcohol and substance misuse tend to be higher in young men and are associated with an increased suicide risk. While impulsive behaviour associated with alcohol use was also highlighted as one of the main risk factors for suicide among young men, it was reported that the majority of young men who take their own lives are actually intoxicated at the time. So if you drink alcohol and take other drugs at the same time, the effects can be unpredictable or dangerous. The combination of different drug effects is called a drug interaction. Interactions can happen with alcohol and prescription and over-the-counter medicines and illegal drugs. So these are some of the examples. If we drink alcohol with antibiotics, this can cause headaches, stomach cramps, vomiting, irregular heart rhythm. Aspirin increases the absorption of alcohol into the bloodstream and can cause damage to the stomach lining. There is also the risk of gastrointestinal bleeding. Paracetamol can potentially have a lethal interaction with alcohol and increase the risk of liver damage. Taking antidepressants with alcohol can increase the side effects, also make the depression worse, as we covered in the previous slide. Taking sedatives with alcohol can cause poor coordination, dizziness, slower reaction time, memory loss, increased risk of overdose, and it can slow down your breathing or heart rate, which can actually cause death. Taking cannabis, amphetamines, and particularly more recently cocaine and alcohol are extremely unpredictable and dangerous. So another significant effect on well-being is the effect of alcohol on sleep. Any amount of alcohol can affect sleep, even one glass. So we might think that sometimes it helps us to sleep because the initial drowsy effect, but this soon wears off, and it can lead to waking up more often and a low quality sleep. If this goes on for a period of time, it can result in chronic sleep problems and sleep apnea, for example. We know that sleep is really important for health and well-being, so it's very important that people are actually aware of how alcohol disrupts sleep. And if you are going to drink alcohol, it's recommended that you don't drink for at least 3 hours before bedtime. So in terms of alcohol and sexual health, alcohol can negatively impact sexual performance and cause impotence and reduce sex drive. Alcohol can reduce a man's fertility and affect sperm quality. So we talk about prenatal alcohol consumption and exposure to alcohol for the fetus from a woman's perspective. And I'm speaking about this topic as men often have a woman in their life, and this messaging really does need to be for everyone. So in terms of prenatal alcohol exposure, that's alcohol exposure to the fetus. Alcohol is the most common and dangerous teratogen. That's something that causes birth defects. Other examples are lead and tobacco. Alcohol readily crosses the placenta and may disrupt fetal development. The placenta provides no barrier from alcohol to the fetus. So one sip for you is actually one sip for your baby. And as well, we know that the baby's liver is not developed enough to break down alcohol. The important thing here is that harm from prenatal alcohol exposure is determined by dose, pattern, timing and duration of exposure, fetal and maternal genetics, maternal nutrition, concurrent substance use, and epigenetic responses. And this is why we say there is no safe dose of alcohol at any stage during pregnancy. And we know that prenatal alcohol exposure can cause fetal alcohol spectrum disorders. So why are we talking about this today, and why would I describe this as a emergency situation? Well, it's really, in terms of the Irish context, we have been shown to be have the highest prevalence of alcohol use during pregnancy in the world. So up to 68% of women report that they drink some amount of alcohol in pregnancy in Ireland. And although we don't have a prevalence study in Ireland, analysis was conducted based on the previous slide, and they reported that Ireland has the third highest estimated prevalence of fetal alcohol spectrum disorders in the world, behind South Africa, Croatia, and then there we have Ireland. So it really can be described as a public health crisis which is why in any alcohol harms presentation, I am actually mentioning this issue. And for men, there is also some evidence that if a man is trying to conceive with a partner and consumes alcohol, that this can affect the sperm. Emerging evidence has also shown that paternal consumption of alcohol before conception can trigger epigenetic changes in male sperm, potentially linked to paternal FASD. So that male alcohol use may actually play a major role in these disorders. So then looking at alcohol as we age, so as we get older, our bodies are less able to break down alcohol and we're more likely to feel the harmful effects of alcohol on our health and well-being. Over time, the same amount of alcohol can have a greater effect, even if our drinking habits have stayed the same. As we age, we are more likely to experience health problems and our risk of many conditions increases. And because of this, we don't tolerate alcohol as well as younger adults. These harms are similar to the ones that I mentioned before, such as cancer, liver disease, heart disease, but they are more harmful in older people. We have problems then with interactions and medicines, which can be quite serious, and increased mental health problems. One thing is that often older people drink alcohol for different reasons than younger people, and one of those in particular is loneliness. So we really do need to be mindful of that. There can be weight loss where increased drinking can reduce or result in a decrease in eating, and then the person may be malnourished. Falls and injuries are significantly increased when older people drink alcohol and can result in life-changing outcomes such as a broken bone or a hip. And finally, alcohol can actually cause dementia and Alzheimer's disease. So beyond the serious health consequences and the harmful use of alcohol brings significant social and economic losses to individuals and society at large in Ireland. The most common harm is harm to the family, with children identified as those most vulnerable. More than 1 in 4 of Irish adults experience harm from someone else's drinking. Women suffer more family and financial problems, whereas men are more likely to report assaults, all mostly caused by other men. So what can we do then for our clients and patients? We have this leaflet which can help with thinking about our drinking habits and starting that conversation. So using our Making Every Contact Count programme as the brief intervention tool, it shows how much is in a standard drink, and it can be useful to work out how much we are drinking in a week. This just creates that awareness in ourselves or for our patients and clients to start a thought process, maybe where we might want to reduce this amount. And then if needed, there are useful ways to cut down if that was appropriate. So this is the inside, and we can see that the lower risk guidelines there for women are 11 standard drinks per week, and for men it's 17. And you can also see that 1 standard drink is half a pint of beer, a small glass of wine, and that's 100 millilitres, which is actually quite small in a glass and often as a surprise to many people, or 1 pub measure of spirits. Another key thing to highlight then is to not use industry funded information like drinkaware.ie as a source of information, as this is actually the drinks industry. We always use HSE askaboutalcohol.ie as your evidence-based information and services. So one piece of training that I give for staff is that we have, if we have clients that maybe having issues with alcohol and we'd like to support them in making a change, we have the SARE training. So this consists of an online module where you learn everything about the SARE model, and then it's a 1-day in-person training to practice your skills. The SARE model is patient-centred, so it's about what the person wants themselves to cut down or stop drinking altogether. And people have found this training very good in having that sometimes difficult conversation. So if you're interested, please do contact me for the next training day. And then for those who need more support for their alcohol issues, we have the SARE Extended Brief Intervention. So this is based on that SARE model as in the previous slide, but this service is 6 sessions and it's 1-to-1 with a support worker where the client can cut down or cut out their alcohol use, whatever is appropriate for them, and then it's completely client-led. These are in primary care centres as outlined here, and reduces that risk of stigma that many people might feel going into a treatment centre. So this is how you refer to any alcohol service. So we have the integrated alcohol service is the central port of call for any referrals to do with any level of alcohol issue. So for those that need more than a brief intervention or the support that you can give, using this SARE model training, for example, these are the contact details, and a person can self-refer, and then they're screened and triaged to whatever is the most appropriate service for them. So it could be the SARE extended brief intervention, as per the previous slide, or indeed if treatment is required. But that is decided at that screening stage of the contact, so it's not something that you need to decide for your patient or client. So these are then some of the resources available on healthpromotion.ie. So we have the Men and Alcohol leaflet, the Getting Older in Alcohol, and then of course the hidden harms to children as a result of parents' alcohol use. So just to finish then, the key message I suppose is that there is no safe amount of alcohol for our health and well-being. Resources are available at askaboutalcohol.ie, where there is a drinks calculator and all the services in the area for a range of needs. The leaflets and posters are available on healthpromotion.ie. And always just a reminder then not to use industry funded resources like drinkaware.ie because they are the drinks industry. So that is it. Thank you very much for listening.